Brittany Matchett, she asks, what do you do different in a geriatric massage and what actually is it? With a geriatric massage, let's say a person is over 60, some people classify over 65 as geriatric population, but it all depends on if they've had a lot of massages before. You might be able to go a little bit deeper, especially if it's a regular client of yours, and then to get up in those age range. But with geriatrics, usually you got to be more cautious of blood clots, varicose veins, heart problems, thinning blood, all those different areas. So that's why it's a little bit lighter massage in general, and typically you don't have to go an hour. You can even do 45 minutes or half an hour, especially the older they are. So let's say 75, 80 years old or so. You don't have to give them a full hour because sometimes a full hour is too taxing for the body then. But again, everybody's belief is different. If the client is more used to massages, even though if they're in their 70s and 80s, they can handle an hour, some maybe an hour and a half. But just in general, for geriatric massage, sometimes it's harder for them to lay on their back, so you might have to prop them up a little bit, or it might be hard for them to be positioned in the prone position. So um, with that, if it's hard for them in the prone position, you might have to do side lying position with them. So side lying, you're basically having pillows in between the legs, have a pillow underneath their head, and even have them hug onto a pillow is the best option for a geriatric massage. But for a semi-reclined position, I call it, you have to put 2 or 3 pillows underneath the head to elevate it some, and then you can put a pillow or 2 underneath the legs too, especially if they do have any kind of swelling or edema. But with the geriatric populations, there's a lot more porous circulation, so that's why, again, raising up the legs too if they have any kind of edema or swelling. And sometimes they might have TED stockings, they're called, the really tight stockings. With that, you'll have to remove them. But you can even ask for permission. Is it okay if I put them on you right after the massage? So it's easier for the person, because if they start walking around and put those on, then it's going to be harder to put those TED stockings on, because that's why, again, in the morning it's better before they get up and walk around, because then the fluid drops then. But if they have a history of blood clots, it might be a good idea to get a permission from a doctor, just to be safe, or just concentrate on certain areas of the body. Try not to do a lot of circulatory massage, so not a lot of long flowing massages, massage techniques for the geriatric population. And you got to be careful of your nails, very careful, because especially if they're on blood thinners, if they get a little cut, they don't clot as good then, because if they're on Coumadin and morphine and those kind of medications that thin out the blood to help out if they've had strokes in the past, that's why you want to be aware of your nails, of all things, when you're massaging, just to be safe. And with another thing to be cautious of with the geriatric population is osteoporosis. So when I've worked in nursing homes, even if the client's turning or if they cough, sometimes they can even break ribs that way too, so it could be that severe. So that's why you want to make sure you ask them how severe their osteoporosis is, if they have those kind of ailments or problems. And if you, let's say you're going into a nursing home to give a massage to a client, what you want to do is put on the call light and have the nursing assistant or the nurses turn the person whenever you need them turned. Or let's say with their Depends, they have some bowel movement, you smell something in there or something, just put on the call light. You don't have to clean up those kind of things. So I myself, before I started teaching massage, when I had my business, every now and then I would go into nursing homes, because that was my part-time job too, going into nursing homes. And but even though I was trained as a nursing assistant and stuff, I would still put on the call light, just because that's not my scope of practice in a way during that time. But I would have clients come into my place of business, and sometimes I might have to help them on the table, but it all depends on what you feel comfortable with. That's the main thing. And you can even request that they have somebody else come with to help position, or those kind of things too. But again, with geriatric massage, there are just a lot of more precautions that you want to take. Make sure you know about the ailments, problems, diseases they have. Always have a pathology book available. And if in doubt, look it up. It's even okay to look it up in front of the client. I myself, when a doctor actually looks up something, I actually appreciate them even more because I want them to be sure. I don't expect them to know everything, but they are human, and I'd rather them have a little bit of doubt and look things up than just be really cocky and this is the way to go kind of thing. So again, pathology books is a huge thing to make sure you have available. Or if you don't feel totally comfortable when they're getting undressed, you might be when they are getting dressed. I mean, when they're getting undressed, you can look at the pathology stuff too. Another big thing with the geriatric population, sometimes they tend to have lower blood pressure. So you want to make sure that they, when they're done with the massage, that they just sit up on the table for a little while, or move around really slow afterwards too. So that's another indication. Or if they have too high blood pressure and it's not under control, they might be contraindicated. So that's why, again, make sure you have a pathology book just to be safe when you're massaging that kind of population. Any other comments, suggestions, anything that when you massage geriatric population, please leave your comments below. Thank you.